Good afternoon, everyone. Thanks for tuning in to another of our programs here at the National Museum of Civil War Medicine. I'm Kyle Dalton, the Membership and Development Coordinator. With us, as always, is Jake, and we're happy to welcome Jim Downs, author of Sick from Freedom. So we're going to have a brief interview here, and while we're asking some questions, we encourage you to ask questions as well. If there's anything you'd like to know, just ask it in the comments. I can't see them. I don't think Jim can see them, but Jake can see them. So Jake will relate those to us. And remember that these programs are provided free of cost. And if you want to support us, consider becoming a member or giving a donation. You'll find that in the comments as well. Or you can go to our website, civilwarmed.org, and you can give through there. So Jake, would you like to take it away from there?
Yeah, absolutely. And thank you all so much for tuning in today. I know we have people joining from across the country. I've already seen some people saying hello from New Jersey. If you are watching out there, want to let us know where you're watching from. That's always fun to see and to help get the conversation going. I know Kyle and I have been very excited about this, as has the entire staff, about today's interview. And so I want to welcome Professor Jim Downs onto the National Museum of Civil War Medicine's Facebook feed.
Well, thank you so much for having me.
Yeah, we've all been eagerly looking forward to this. I know many staff members at the museum are big fans of your book, Sick from Freedom. And that's what we wanted to talk about today. So just a little bit of information about Jim, and I'm sure we're going to get a little bit further into this as the conversation goes, but he's a professor of history at Connecticut College. And what we're going to be talking about today is his 2012 book, Sick from Freedom, African-American Illness and Suffering During the Civil War and Reconstruction, that was published by Oxford University Press. So Jim, we want to dive right in here today. So can you tell us a little bit about your background and what got you interested in medical history and the Civil War era?
So I think I could probably trace it to two sort of inspiring moments. The first was when I was an undergraduate. I started to read and get exposed to the history of the slave narratives, which was like this whole sort of project that developed mostly in the 1980s and 1990s by literary scholars. And so it was the detective work of those literary critics that found these voices of mostly Black women from the 19th century that was truly sort of inspiring and earth-shattering. And it was also, just from the research point of view, the kind of detective stories that these literary critics were involved in that really captured my imagination. And so that was part of what was going on in the back of my head. And I had read Harriet Jacobs' narrative, which was authenticated by Jean Yellen, and that was part of my interest in the Civil War period. And then I was teaching middle school and high school in the 90s, and I got very lucky to get an NEH fellowship for teachers, where I went to Georgetown for the summer, and it was a 4 to 6 week program, and every morning there would be a different scholar that would present their research. And so this was everyone from Barbara Field to Tara Hunter to Thabolia Glimp, and then the afternoon we would go into the archives at the National Archives and do research. And at the time I was working on the education division of the Freedmen's Bureau, because I was trying to find documents for my curriculum. And so it was really interesting to just go in the archives and find these accounts, again, mostly by Black women who served as teachers from the North, and even free Black women in the South. And so that narrative of the work of Black women educators, combined with what I knew about the slave narratives, really started to draw my attention more closely to the war and then to Reconstruction and to Harriet Jacobs. And when I started to do that, I started seeing Jacobs made many references to the sickly conditions of formerly enslaved freed people. And at the time I entered into an MA program at Columbia, and I worked with Eric Foner. This was long before I got my PhD. And I realized that there was really very little about medicine and health in the Bureau records. In the historiography, it was in the Bureau records. So I eventually applied for a PhD. I actually ended up going back to Columbia, and I decided to think about this. And I started taking courses in medical history with people like David Rothman, who actually began the field of history of medicine. I mean, was one of the sort of architects. I mean, history of medicine had been around for a while, but really popularized it with his book, The Discovery of the Asylum. I just want to clarify the historiography there. And then David Rosner had recently been hired at Columbia when I got there. I got there at Columbia for my PhD in 2000. And they were trying to, at the time, they were trying to bring social history in with the history of medicine. So my arrival there just sort of coincided with a trend within the department. So both of those forces sort of led me to studying the history of medicine. And then Eric Frono was my advisor. So that's pushed me in that direction.
Now, you talked about this as being a blend of the history of slavery, the history of the Freedmen's Bureau, the history of medicine, and also a social history. Those are a lot of different angles to come at this with. What was your process for bringing them all together into a coherent narrative?
Right. So the first thing is to really just remember that the 19th century Freedmen's Bureau records are boring as hell. So it's not like there's some of them that are really interesting and illustrative and fascinating and gripping, and a lot of it's just bureaucracy. And bureaucracy can be an amazing thing because it can capture the ordinary iterations of everyday life. However, when we think about medicine and race, we often think about it in terms of eugenics, which is a late 19th century project. And so we sometimes go back and we think, well, there was Samuel Cartwright, there was antebellum medical thinkers who believed in racial difference. Sure. So it's bookmarked. On the antebellum period, you have racialized medicine, the emergence of racialized medicine. And at the end of the 19th century, you have the rise of eugenics. And then you have the Civil War, which is in the middle. And if you go to the records, if you walked into the National Archives and you looked at the medical division of the Freedmen's Bureau records, it would just be a really boring bureaucracy. Things like, I got your correspondence. When are you sending me the next correspondence? I got your report. Oh, I forgot. What kind of report do you need? Oh, I don't know how to fill out the report. So then it began, to answer your question, it was using the tools of Black feminists and using the tools of Black women scholars, which was to say 1980s, 1990s Black feminist criticism and theory was always about finding lost subjectivities. So it was about finding and recovering the Black women's voice as authors, but it was also like finding, Toni Morrison wrote this great book called Playing in the Dark, which is about thinking about how race plays out within the construction of canonical text. All right, but if you use that analytical frame and don't apply it to literature, but apply it to the boring sort of bureaucratic records of the medical division, it'll start opening up those records in a completely different way. If you start looking for what Valerie Smith, Farrah Griffin, Hazel Carby call the utterances, the ellipses, the silences in the record, you're going to be able to then tease out that kind of subjectivity in a way that if you just, the way that a typical social historian might not find it. So all of those tools came into play when I was doing this research because the records are uneven. But if you're a Black feminist critic in the 1990s, literature's uneven, the canon's uneven. So that's what gave me the tools. And I think that's always been such a huge part of my mind. And I never, it's only like, I'm starting to work on a new project, which maybe we could talk about at the end. I'm starting to articulate the application of those theories more clearly so people can understand how to do this work.
Yeah, so going back to the kind of the mission of our institution of the museum, we're focused on the Civil War time period, of course, the Civil War era. We have in recent years kind of started out as being just on the 4 years of conflict, but as we all understand, you need to know what happened before, what's the state of medicine going into the conflict, and then ultimately where is it going after the conflict is over. And so we document, our institution documents this medical crisis that comes about in the Civil War. And you're coming at this from an angle that is oftentimes very different than the traditional narratives of Civil War medicine. So can you talk a little bit about what the impact of this medical crisis during the Civil War era had on the hundreds of thousands of people fleeing slavery for safety within the lines of the U.S. Army?
Well, so the first is just that. I mean, even today, when we talk about the Civil War, we still have inherited this sort of romantic notion of what death looked like. And so death on the battlefield was this romantic death. It was part of, there were certain rituals that Drew Faust talks about in her book, The Good Death. And so When we do that, when we engage in that kind of memorialization, we obfuscate the reality that more soldiers died from what they called in the 19th century camp diseases. And camp diseases is a term that covers a panoply of the disease from any kind of infectious disease, dysentery to yellow fever to smallpox to malnutrition, typhus. There's tons of different epidemics. So formerly enslaved people, they liberate themselves from slavery. And the question is, where do they go that night? How do they find food that next day? Where do they find shelter? And if they're lucky, they can find it in these makeshift refugee camps that the Union Army has set up, which, by the way, the Union Army doesn't initially accept them in. So there's a whole policy and a way that this actually develops that I talk about in the second chapter of my book. So once they eventually let them in, they let them come into these makeshift camps. Once they're in these makeshift camps, they're in an environment that is plagued by all of those infectious diseases. And without the basic necessities, without shelter, without clothing, without food, they become susceptible to it. Now, here's the interesting thing. It's the 19th century. So as soon as pro-slavery Southerners see this mortality, they report it as innate inferiority of Black people. They report it to say that the pro-slavery parable is true. Black people cannot survive in freedom. Then, and this is interesting in terms of the epidemic today, in terms of questions about the pandemic, the abolitionists are afraid, they're reticent to report it because they realize that it's going to further play into this stereotype. And they're afraid of what it's going to mean for Black suffrage. So it's interesting from an archival perspective. If you look at the major newspapers at the time, so you might see something in The Nation, you might see something in the New York Times. I have this in my book, but it's really the benevolent records, the former abolitionists that have constructed this huge network. Their internal records, which would be something like the Freedmen's Aid newsletter or something like the Freedmen's Monthly. These are organizations created by the Quakers and by the New England Freedmen's Aid Societies and other former abolitionists. In those papers, they'll talk about the mortality rates and they'll talk about disease. So that's how that connected to my earlier point about how these were Black women and these were abolitionists, and we have to think about how these records are all working. But the point is, there was reasons to cover it up. And you can see this today with the pandemic. I mean, there was a way in which, I immediately thought, oh my gosh, this is dangerous to say quarantine. I mean, first of all, let's just put it out there that people in the 19th century, quarantine was invented in the 14th century. By the middle of the end of the 19th century, people thought quarantine didn't work. So, we have to first know that. And so, but really the issue is you have quarantined populations of people, you place Black people, formerly enslaved people in crowded conditions, you quarantine them, but then the epidemic spreads among them. And so that's exactly what happens today within brown and Black communities. They're quarantined, as part of their safety. But then there's all of these weird caveats like, oh, well, if you're an essential worker and you work in a grocery store, you can come out, or all of this stuff. And then there's a point of, wait, do we have to talk about the mortality rate? Do we have to talk about the infection rate? Because if we do, then that's going to blow a hole in this whole argument about essential workers, or it's going to blow a hole in what we think of, it's going to play into a stereotype about Black inferiority. Why are Black people suffering at higher rates? So you can see, there was a silence around not reporting those numbers initially. And it actually was analogous to what happened in the mid-19th century around freed people, except that today, because of Twitter, because of other things, we were getting the infection rates of Black people. In the 19th century, they just hit it. So if you look at the Congressional Globe, if you go through Lincoln's papers, you go through any of these major archives, you will not find the word smallpox. Yet smallpox plagued the post-war South.
So we're seeing a lot of refusing to talk about it, sort of pretending that it's not there. Did that translate into a lack of relief efforts? What were the efforts of the U.S. government and medical department, if any, to treat the freed people?
Right. So there's a silver lining to this crowd, and there's a silver lining to this cloud, and there's a positive story to be told, and there's an interesting sort of moment in American medical history, and then there's something that's deeply problematic and disconcerting. So the silver lining is essentially this. The federal government does something in the middle of the 19th century, which is completely unprecedented. It establishes the Freedmen's Bureau, which is, before the creation of the welfare state, it places federal officials in face-to-face contact with ordinary citizens. That's a brand new idea. And it sets up schools, it helps to mediate labor contracts, and then it does this amazing thing, which is it establishes over 40 hospitals throughout the post-war South, and it deploys close to 120 physicians. So on one level, this is a really important revolutionary relief effort. And it provides medical care to something like 1 million freed people. And that medical care could just be basic care and comfort. But the issue is, as I explained in the book, this notion of medical care is never untethered from concerns about political economy. It's always connected to the creation of a labor force. So they're going to construct these hospitals, they're going to do all of this work because they're fundamentally interested in making sure that the labor force is healthy. And I don't mean necessarily making these people healthy. The idea is creating hospitals so that they're sheltered and that so they're quarantined from the population who could work. So this is where my book plays off of David Rothman's book, The Discovery of the Asylum, which is you can see the growth of asylums in the early 19th century develop at the same time as capitalism. So they're you can look at them as like these benevolent institutions, but fundamentally they're developing at the same rate as capitalism is expanding because they become this place that shelters people who can't join the labor force. And so then what happens is, so that's a good thing. The problematic thing that we can see today is, and I would see this in the records, is that all of a sudden, as soon as the rates of smallpox would decline in the South, they would say, we can close these hospitals. And these were Army officials who had served in the war. They want to go home. And as soon as they see the slightest dip, they're out of there. The problem is the epidemic then spikes again for something like smallpox. But then the record's silent because of the fact that there's not an official there to catalog it. So you'd have to look at what's called the assistant commissioner record. So that, say, for example, in South Carolina, you have the guy in Beaufort who says, all right, listen, this, and it's a guy, this is going, the smallpox rates have declined and I'm shutting down operations. Well, then the assistant commissioner has the broadest view of the entire state. He can see it popping up in Charleston, in the Sea Islands, and other parts, so that's how it worked. And that's where it became somewhat, it became problematic.
You've touched on this a little bit by talking about the hospitals and the legacy of those hospitals. We see a lot of this in our stories, this sort of uneven legacy of Civil War medicine, where there are some great advancements, and there's also a history that we're still standing in the shadow in of failure, of challenges that we didn't quite overcome. How does all of this translate into the Reconstruction era for the freed people? What's the treatment like? Does it get better? Is it still very much sort of under the radar? Do the political dynamics change?
I mean, it's hard to, I would say that it's hard to make like a sweeping statement to describe the entire post-war South. So I would just step away from doing that entirely. I would say it just depends. It's very local. So in a place like Washington, D.C. and other places throughout the South, you had something called these Freedmen's hospitals. And some of these Freedmen's hospitals continue to survive down into the present. So the Freedmen's Hospital in Washington, D.C. is now Howard University Medical Center. So I mean, like that's kind of evolved. A lot of them were shut down as a result of the Flexner report at the turn of the century because they were viewed as inadequate. So on one level, based on segregation and discrimination, many Black physicians couldn't practice in white-only hospitals. So they went into these Black hospitals and they worked as doctors, and so did the nurses. So that's one of the effects. The other effect was that the federal government always intended that any Reconstruction effort would be temporary and that states would take over. And so you can see the Freedmen's Bureau collapsing by 1869, 1870, and you can start to see, as I mentioned in chapter 5 and 6 of my book, you start to see them hand over the responsibility to state governments, and it just depends. Again, when state governments eventually open their doors to these people, it's sometimes for infectious disease, but it's more often than not for people who are mentally disabled because, again, not because they care about providing them with medical support, but because they're afraid of the kind of and this is the language of the records, like the nuisance that these people provide. They set fires, they create, issues. So what happens during the 1870s is that there's this uneven transition to the state government, and ultimately Black people in the 1870s and 1880s need to take their health in their own hands, and they can't rely on these municipal or state interventions, and of course not federal interventions.
Yeah, that the story from Washington D.C. is particularly of interest to me. I'm glad that you mentioned it. I live in D.C. Been here for about two years. Working at the Clara Barton Missing Soldiers Office Museum, right. And I live in the vicinity of Logan Circle, which was the site of Camp Barker, right. One of those, contraband camps as they became known, yeah. And Freedmen's Hospital site. And yeah. I have to just say that one of my personal heroes out there, and I know Jill Newmark is watching, right. Is Alexander Augusta, right. and one of the real heroes. I think of Civil War medicine just writ large, how much he and the other African-American surgeons and other medical personnel were able to accomplish. But I want to go over to the comments. We do have about 70 people watching with us consistently, which is great. Thank you all so much for tuning in with us today. If you are enjoying our conversation today, please give us a like. Give us a share. That helps to get more people involved in the conversation, gets this story out to more people. And if you are really enjoying these videos, we have been doing them since mid-March when our doors were closed as a result of the pandemic. Please consider becoming a donor or a member. Every little bit helps. It goes right to supporting these kinds of conversations, these kinds of videos, and allows us to continue to do this work. And thank you so much for those of you who have already donated and become members. We've been just amazed by the support that we've gotten for doing these projects. Jim, so I want to talk kind of overall, just kind of your opinion on this from your perspective, coming at the Freedmen's Bureau from this health perspective. What do you think? Do you think that the Freedmen's Bureau did a good job overall? I know you talked about it being the local. It's really a kind of a local issue. But what did you take away after all of this research? From what you saw of the Freedmen's Bureau?
Right. I think this is like a question that I think I even got in my defense, dissertation defense. So I'm just going to plagiarize what I said then. I don't know. I don't think this idea of whether it did a good job or a bad job is really important. I think from what I've seen, it really depends. And I understand why you're asking. It's totally justified. It's a totally fine question. But I think that it depends on each locality because every hospital is different. So the hospital that, like you mentioned, Alexander Augusta, he's run in Savannah. I mean, really great. I mean, he's not falling into racist logic about why Black people are becoming sick. He's looking at sanitary conditions. He's looking at the water. I mean, I talk a lot about that in my book. He's really investigating what caused sickness and disease. So wouldn't want to flatly say it was terrible. Then you have Augusta, or you have Jacobs, and then you have some doctors who were terrible that Jacobs actually criticizes because Jacobs goes to the South to set up schools, and then she becomes a sort of medical reformer, and that's all in the book as well. What I would say is this: I would say that the medical records reveal the medical crises that plagued the period. I think that's something we have to talk about, and I think it's really hard for me to talk about this because I mentioned my book and I mentioned this work, and everyone's like, "Oh, that's great," and then 2 years later, people are like, "But let's go back to Black politics." And I'm like, we know the story of Black politics. I mean, Du Bois played the story of Black politics. Eric Foner has done the story of Black. I mean, you can add something. But are you really going to transform the story by talking about the legal history or the political history of Reconstruction? I don't know. I don't really think so. That's my opinion. Someone could, write something that really transforms the field, that undoes Foner, Hahn, also Barclay Brown, all these other people. What I actually think is that we're living in a pandemic today. You know what that's like. The smallpox epidemic that formerly enslaved people lived in was 10 to 20 times worse. I mean, not to add some kind of like empirical account to it. And yet we can still go back to the historiography and be like, well, let's talk about this case or this idea. And then when I say, well, let's talk about the medical condition, it seems like, oh, you're just promoting your own book. And okay, but I'm also trying to say, like, this is what it meant to live during an epidemic. And we should remember that the Freedmen's Bureau, whether right or wrong, good or bad, illuminates this massive mortality, this massive rates of infection, this massive poverty. And that needs to be part of the story. And I think that that's something we need to sort of think about. And I think today, hopefully, I mean, if there's a silver lining to any of this pandemic, is for historians and people interested in history to really think about what health means and how health is both an actor and sets a context, but also just how it shapes and informs people's lives.
Well, since we're on this topic anyway, I think that rolls into our next question here. We at the museum, our mission is to relate lessons of the past to the present, to directly impact the way we think of things today based on the lessons of the past. And the Civil War is a great time to do that for medical history.
Right.
You happen to be at a great intersection of medical and racial history. So what do you think we could learn? What are the most important lessons we can learn from your area of study?
A lot. I mean, I would say that one of the things that people talk about constantly today is when we're talking about COVID-19, that if you have certain kinds of underlying conditions that could exacerbate, how the virus works within your body. When we think about underlying conditions, we think about them in a very sort of like textbook pathological, like in terms of like very classic pathologies, everything from asthma to diabetes, et cetera. But one of the things that we can sort of talk about is, what is poverty? How is poverty an underlying condition? How is racism an underlying condition? I mean, these are underlying conditions that are actually setting the stage for how people face the epidemic. So when, this famous phrase, we're all in this together. Well, we're not all at the same starting point when the epidemic broke out. You're living in environments that are differentiated by class. So how could you all be in this together? You can't be in this together. And so your socioeconomic status shapes your health, and that's an underlying condition. And so when I think about my book, I think that what medical historians, what people in the medical humanities, what medical anthropologists have been trying to say is that we have to expand the notion of what we call the biosocial reasons for causing disease to spread. And so like the easiest example is that people who, it's a privilege to be able to stay at home. It's a privilege to be able to quote unquote shelter in place. For people who can't, they're going to be exposed to the virus. And that is a socioeconomic issue. And that's an underlying condition. We think about quarantine. We think, quarantine is a good idea. Sure, if you have a 5-bedroom house and you turn your garage into a gym and you're making banana bread and you're Instagramming with your kids. But if you're a family of 5 that's living in a 1-bedroom apartment, what does quarantine mean then? And so I think that that's something that's really useful to think about.
There's a great comment here that I love, comes from Enid. We're all in the same storm. We're all in the same storm, but we don't have the same boat. Some don't even have boats.
Right.
Yeah, I think that's a great comment. So I have a couple of questions here from the audience. Thank you so much. If you have any questions for Professor Downs, please throw them into the comments, and we'll get to some of them. But we have a question here about United States colored troops, and just could you speak a little bit about kind of how USCT soldiers kind of came into contact with your research?
So it's interesting. I work on them. I'm working actually on them more in my current project than in that project. In many respects, it's a lot of stuff that people already know. So it's nothing new insofar as that Black troops often had they had inadequate barracks. They didn't have inadequate uniforms. They have boots that had holes in them, all that type of thing, all of those kinds of problems that exacerbate it. I guess what I would say is, let me just think, I'm going to think this through a little second. One of the things that Black troops had is that they had their families with them. And so the opening story of my book is the story of the Miller family. So when we think again about the war, we think about this patriotic idea of suiting up for the war and fighting for your cause and hoorah, right? But what does that mean if you have to bring your 3 or 4 children and your wife? And you are engaged in a military campaign, you're engaged in just labor, working for the camps, which is what a lot of this Black soldiers did. But then you're also concerned, as I explained in my book, about whether or not your family who's living in this adjacent makeshift camp has resources, has the ability to survive. And so the story, opens, or the book opens with what I won't say it here. Hopefully you'll read the book and find out. But, it opens up with this tragic case of what happens to his family. So the Black soldiers not only had to worry about themselves, they also had to worry about their family. I think that's really important. The second piece is, this is more of just not in the book, but it's going to be in the future project, is largely the Sanitary Commission is engaged in a number of different kind of racist practice that's trying to understand the spread of infectious disease. And they essentially argue that it's a result of race. Now, this is really an important point, because on one level, you're like, well, that's kind of dull and not surprising. It is surprising, as I will explain in my forthcoming book that comes out this January. It's surprising when you think about epidemiology within the broader world. So if you look at British troops, if you look at what's happening in colonial India, when you look at what's happening in the Caribbean, yes, there are times when they're making distinctions on race, but ultimately the people who are that are leading the field of epidemiology are looking at sanitary conditions in the built environment. They're not saying disease is spreading because of race. And so when the new ideas of epidemiology reach the US, instead of saying, hey, let's think about the tents, or let's think about the uniforms, or let's think about what they're eating, they fall back on this notion of race. And so it actually supports what Barbara Fields calls like the sort of ideology of race, that there was this critical moment in the Civil War where the ending of the war could have led to, the demise of racialist ideology. But instead, the Sanitary Commission uses race as a metric to understand infectious disease, and they imbue it with a kind of power, an analytical power that can help explain why disease is spreading. So now race has a biological function to it in a very clear way through the Sanitary Commission and through the bodies of Black soldiers.
We've got more questions in the comments, I know. Before we get back to those, first of all, Joy, thank you for becoming a member from Fredericksburg, Virginia. We just got a new member through this stream. Thank you so much for supporting this. Also, since we've talked a little bit about it, would you like to tell us about your upcoming book?
Right. So it actually grew out of Sick from Freedom, which is to say that when the smallpox epidemic spread, there were lots of reasons why the government argued that it did. Part of it, they said, was, well, there's some Black inferiority and they're more susceptible to disease, et cetera. But they also said, look, we don't have the time and the resources and the money and the manpower to get materials from Washington, D.C. to Shreveport. And it's like, okay, well, that's kind of legitimate, 1864, 1865. How do you do that in the middle of a war? But when a cholera epidemic breaks out, which they understood what smallpox was for centuries. In fact, they knew what it was, and they had developed protocols in the early 19th century throughout the US. But cholera was brand new. It came from, they called it Asiatic cholera. It was a pandemic. It came from India. This mysterious bacteria, without really knowing how it spread, they managed to efficaciously prevent it from becoming a serious problem in the US. And I found a record called the Surgeon General's Report from 1866, in which doctors report throughout the post-war South, hey, we're stopping it. And it's like, well, wait a minute, you couldn't stop smallpox, but how did you stop cholera? And so the reality of it is they stopped it because cholera affected white people. And so they engaged in this major sanitary campaign to do it. So I was like, well, how? So I thought, all right, that's fine. I wrote about that in Sick from Freedom, fine. But then I thought, well, how do they know? And so how they learned it was they learned from the British. And then how did the British learn? The British learned through imperialism. So the book basically traces the rise of epidemiology. Epidemiology is a field, develops in 1850 in London. And it develops as a result of 3 factors that I argue in the book: slavery, mostly the international slave trade, imperialism, and the Civil War and the Crimean War. So on one level, what I'm doing is I'm taking all of these major events that we know about in the late 18th and early 19th century, and I'm showing how they're all talking to each other and how they're all connected. And so it's a global project in that respect. And it's uncovering these kinds of networks that we didn't know really existed. before, and it's showing how the field of epidemiology resulted from studying enslaved people at the bottom of boats. It resulted from studying troops during the Crimean and the Civil War, and it resulted through various forms of colonization and imperialism.
I'm really excited about that. I like the idea of the international look at this. I used to do research on the transatlantic slave trade for London Town in Maryland. We got a couple of questions from the comments. Andrea Pike asks, didn't the abolitionists play a big role in the Sanitary Commission? She wants to know what their thinking was and how that played out, given the Sanitary Commission's role in the post-war era.
Yeah, I mean, so one of the good things is, this is really interesting. It's kind of a flip. Who makes up the Sanitary Commission? Women. And then where were they? Abolitionists. So that should tell us that most abolitionists were women, but I'll leave that historiographical time bomb alone. I mean, most people ignore the significant role that women played as abolitionists, which is a huge part of the history Nancy Hewitt, among others, has got into. But the point is, the Sanitary Commission is different from the Freedmen's Aid Societies, because the Sanitary Commission is really going into union camps, and they're trying to implement various rules to improve cleanliness and to improve sanitation, to figure out, like, actually they don't really understand how disease is spreading. So they think clean clothing, they try to identify what is the source of miasma, which is like a vapor that emanates from rotten vegetation or corpses. So they're just in this massive effort to clean things up. And the Sanitary Commission is really important. It differs from the Freedmen's Aid Societies, which are basically also the same women, the same demographic of people, but who just directed their energies to the freedmen's, to the campaigns to help freedmen, instead of just the campaigns to help soldiers. Surely there are people who are like involved in both.
Yeah, so I have another question here from the comments from a good friend of the museum, Ray Andrew Red. He brings up the kind of new area of history that's gotten in Civil War history that's gotten a lot of interest in environmental history. So he asks about, the connection between kind of the history of health, of medicine, and the natural environment during this time period.
So it's a great question, and fortunately, like, I know a lot of environmental historians have been interested in Sick from Freedom because of the ways in which 19th century doctors tried to trace the spread of infectious disease by looking at both the natural environment and the built environment. So there are ways that the construction of camps actually changed the landscape. And this is one of my favorite things, like Megan Kate Nelson's book, Ruined Nation. She's got the chapter on trees. I think it's like one of the best things I've ever read in terms of Civil War history. Is like new ways of thinking about it, but the idea that the trees are actors, and that, what does it, we think about the construction of these camps, but we never think about the destruction they leave in terms of how they have to sort of destroy the trees, the deforestation. And then there's also just the question of all of this population movement leads to the massive devastation of the environment. I mean, one of the things, again, this is the reason why I think it's important to put this history alongside of the political and legal history, because from the political and legal perspective, what's one of the major debates that animates emancipation? Labor. Will Black people get back to work? So both in the imagination of historians and in the imagination of 19th century federal officials, it was all about, do they work? Should they work? What are the politics? What are the legal aspects of work? Never thinking, what is the environmental reality of, can they work? I mean, the soil has been eroded. The soil has been exhausted. The soil has been destroyed, not only because of overproduction during slavery, but also from all of the devastation caused by the war. So we never really think about the idea of the landscape. We always just think about it, the landscape and the environment are just these sort of unchanging, stable categories. Like, well, the debate is about whether Black people should go back to work. The debate is about what are the laws that are going to get them back to work. It's like, but you're assuming in that formulation that they can work. You're not taking into consideration the environmental destruction caused by the war, that has rendered the land unable to produce crops. More to the point, something that I bring up in the book that I got from the Freedmen's Bureau and Southern Society Project, so I wasn't the person who discovered this. They've been talking about this for years, which is the 1866 drought. again, remember, there's a massive drought that basically sweeps through the South that again fails to provide Black people with any opportunity to cultivate the land, which then leads to massive starvation, you know? So, I mean, these are like, the environment is a key actor here.
Mm-hmm. And this is a good, great question and a good topic to bring up. We do have coming up in the end of this month, I'm recording a video with Katie Shively, one of those environmental historians in the field doing Civil War history. We're going to be talking about her book, Nature's Civil War, which looks at the Peninsula campaign and the relationship between the soldiers and the environment there. Do have another good question that I definitely wanted to throw into this conversation. This comes from Judith. Connections between your research and the Tuskegee study and similar abuses.
So it's interesting. I mean, I think this is more, I mean, this is a medical crisis that's happening at this moment. So a lot of the doctors, and a lot of the doctors are treating patients and they're in a crisis environment. And as I will show in my new book, it's 10, 15 years later that they draw on those case studies and they draw on that information to support various theories. It's not then on the ground. It's, I mean, maybe there are some that are experimenting. We know from Deirdre Cooper Owens' work in the very beginning of the 19th century with gynecology, there's experimentation then. So I'm not saying that experimentation didn't happen. I'm just trying to set the stage to remember the context, that it's not at the same. But what happens, and I'll describe this in The Maladies of Empire, which comes out in January, is that the Sanitary Commission collects a lot of information during this period, during the war, and then they use that information, they use that data to then support various arguments later. So I don't know, should I give away one of my major finds? Maybe. No, it's about I can't. I'm afraid like my publisher will like.
Yeah, we got to keep the publishers happy.
I have to keep that because I don't know. I mean, but yeah. So a lot of these. So the Tuskegee case is a really important case about experimentation. For people that don't know, it's basically just that Black people who tested positive for syphilis they withheld medical treatment on their bodies in order to observe how syphilis went through secondary and tertiary syphilis. So it's like, it was a way of observing it. It often gets misunderstood as they purposely infected them with that. Susan Reverby shows the way that the US government purposely infected people with syphilis in Venezuela. That's a document that she just discovered maybe 5 years ago. It's on Democracy Now! And there's an article that she has about it. So that's the kind of like experimentation that I think that most people think about.
We have another question in the comments from Sharita. She often catches our videos. Thank you for following, Sharita, and a recent member as well. She wants to know if you could take a step back and explain the living conditions that formerly enslaved people would have been in that would have affected their health once they acquired their freedom.
So if they were lucky, they often went to Union camps and they were able to get used tents is one of the things that they had. They tried to sew together whatever materials that former abolitionists provided them with, like in terms of clothing. Oftentimes they were living in bare bones. I mean, with nothing. So I think that there's some great examples. If you go to the website for Camp Nelson, which is one of the camps I talk about in my book, that's a what was called they call it contraband, but it's really a refugee community for formerly enslaved people. They have some sort of creations that they built, that they fabricated, that they made based on some of the descriptions, which are useful. There's others like in Chattanooga. It looks like a little town. It looks like a little village. It's deceiving because it's like the before after. That's the after. That's like the very after. Like the question is what happened before, and sometimes we don't know. They had nothing. I mean, they're left with nothing. And what I find in the records, especially like I said in the very beginning, in terms of the Freedmen's Bureau, in terms of the abolitionist records, you'll find accounts of the living conditions as they would go by a hovel and they would find a dead freedwoman in the hovel. They would go to an abandoned field. They would find a dead family. They would go to a barn. They would find a couple kids starving. They would, Freedmen, these abolitionists are walking through towns. They would see a wagon of dead bodies. So a lot of times they were exposed. The account that I begin the first chapter with is as a young boy who has to have both of his limbs amputated because they froze to death. That's because he was living with no shelter in the elements, and his conditions got so bad that he had gangrene, was eating up his leg. The doctor had no choice but to chop it off. His mother had died in the migration. They were going from Chattanooga to Nashville, then back to Chattanooga, and they're walking. There's no Holiday Inn Express. So it's like they had nothing is what it is. So I would say that, yes, today we're now putting together these modules that look like what it was. That's the after, and that's the lucky day. Like, I even have a slide. People always want to use slides. I don't like to use slides because of this reason. I have one slide that's outside of Virginia, and it's like this makeshift, like 10. It's like part 10, like a couple blankets. I mean, that was the Ritz. That was a good thing. Most people had nothing. And I think that's something, and they were running. I mean, this is the thing I wish if I was a novelist, I'd be able to explain it better than being a historian. When we talk about they liberated themselves from slavery, it sounds so exciting and fun, like liberating. You're liberating under what? Think about every book of slavery you've ever read, every overseer. Think about Stephanie Jones Rogers' book on the plantation mistresses who were vicious. Think about all of these. When they were liberating, they were fighting their way out of slavery. They were punching their way out of slavery. We think of them dancing their way out of slavery. It was a sprint. They were running with whatever they could get. So they oftentimes didn't have shoes, they didn't have clothing. There's a reason why the elderly people were left behind. They couldn't run as fast, right? They didn't want to run as fast. Again, we have this triumphant notion. What does it mean to escape a refugee world? I mean, I think about this all of the time, and the sources are silent because I think for the people that survived it, it was obvious. And then for the people that had the power to write about it, they didn't know. But I think we have to use our historical imagination to think about what that moment looked like. And it was treacherous. So they had nothing. They actually had nothing.
This we have a question here that I think relates a little bit to this, and I just want to say that was just such a powerful explanation of this and what the reality was for most of the people who are liberating themselves with their feet, who are escaping. But it gets to some of the anecdotes you mentioned about finding families, and so in your research, what were some of the sources? What were some of the data that you're accessing where you're pulling some of these narratives out? Is it correspondence? Is it reports? Where are these stories coming from?
Yeah, so I would say a couple different places. So the major place where I found some of the most illustrative stories were at the Massachusetts Historical Society through the Freedmen's records pages, and they have like the largest surviving inventory account of, like, I think it's called Freedmen's Records, in the notes of my book. And so you can get like a year of like 1864 to 1865 or 1866. And all of these teachers, what they're doing is they're writing back to their sponsoring organizations, and they're writing they're describing in detail what the terrible conditions are, so that their sponsoring organizations will send more money and send more supplies and send more resources. So that's part of where you get the kind of narrative shape of this experience from their pens. Sometimes from the assistant commissioner record. So without getting too detailed into what the Freedmen's Bureau records look like, you have field agents, you have judges, you have all these different kinds of bureaucracies, but you have at the top an assistant commissioner. And now, again, it just depends on how good they are, right? So but the assistant commissioners by nature have to write an official report each month. Those tend to be detailed. Also, when I start doing the research between my dissertation and my book, and it's in the notes, it's called Freedmen's Records. I know Pavolia confuses these records too. But anyway, they're online at the Library of Congress. You'd have to look at it. But they were also a surviving form of collated records that provided narrative accounts of what's going on. Now, that said, I'm still doing this research. I'm still very much engaged in it. I'm still thinking about a lot of these questions. In fact, I just found a whole box of stuff that I microfilmed from 2010 and it fits now. I'm like, what am I going to? Okay, but here's the thing. I was in Israel. Yael Sternhell invited me to Israel to give a talk on my book this past January before the pandemic. Yael was working. She's an important person to think about. She's a brilliant historian, wrote a book called The Roots of War, which talks a lot about migration and the movement of people, all of which is interesting to get a visual image of this. Her new project is on the archives, and it's on how the Civil War records were collected. And she's told me that there were accounts of people saying, I saw a huge truck or wagon full of records of the medical division, and they were just left on the road, and they were then destroyed. Every historian's like, right, but so it's like,
oh, that hurts.
there were all of these other records that never survived the war. And so, you know, it's like there could have been larger narrative accounts, but then there's other things like pension records. Pension records offer a really important narrative. They're sometimes written in 1912, 1900, 1890s. They're accounts for people petitioning to get pensions, but in their claim, they're leaving clues about what the war looked like, and they're describing their health conditions. And this is actually, again, to the question earlier about the soldiers. I forgot to mention that's the easiest, quickest answer. The pension records give us the clearest indication of what Black soldiers were going through. And then because they use their rheumatism or dysentery or hemorrhoids, which they always complain about, as a way of trying to claim pension.
Talking about medical conditions brings us back to a question that was asked much earlier. We didn't get the chance to come back to it. Whether you came across any references in the Freedmen's Bureau or medical department from the war of drapetomania or other racially based diseases,
Right.
false and otherwise.
Right. So drapetomania gets coined in the early 19th century as a disease that causes enslaved people to run away. I mean, it actually has like a real 19th century pathology attached to it. No. The way that I think about this as a historian is a lot of those invented diseases about racial science are often created at a moment when Black people start gaining power, and then they need the people who don't want to give them power invent a scientific argument that says they're inferior. So the example I remember growing up, applying to college, was all of a sudden a lot of students of color started getting into the Ivy League. And so bingo, the bell curve shows up and it's like, look, there's an innate inferiority. So the point is those articles, those arguments, those invented ideas can never be divorced from the political moment that they're published. And so they're not actually guiding the way that people think. That said, what's really disconcerting was that because of the dislocation, because of the fact that many freed people didn't have anything to eat, what I started to seeing in the records were accounts of often single freed women who were left on their own, searching for family, searching for friends, searching for food, searching for employment, and then would get picked up by the federal government, and they would get picked up and they would get marked as insane. Now, my question is this. You travel around the South for 2 weeks in the middle of the summer without anything to eat, not knowing where your children are, not knowing where your family is. Let me ask you what your mental and emotional state would look like, right? So this actually triggered for me a really important book by Lynette Jones called Surfacing Up, about colonial, I think it's Rwanda. No, Rhodesia. I don't know. It's Lynette Jones, and she's an Africanist, and the book is called Surfacing Up. Anyway, Zimbabwe. I think it's Zimbabwe. And it was the same thing. British officials would come by these single Black women in the countryside, and they would mark them as insane and stick them into an institution. So the same pattern that we're seeing in colonial Africa in the early part of the 20th century is similar to what happened in the Reconstruction South. So to go full circle, again, when I saw that example in the records, I immediately thought of Lynette Jackson's book, and I immediately realized, okay, that's a way to read that record. That's a common practice. That's a pattern that's happening globally. That's not just some random freedwoman getting incarcerated for mental disease. That is the confluence of race and science and and government power all coming to a head on the body of one person. So that's how you read the record and say, oh, it's just one. So a social historian, a social historian would say, oh, that's just one. That's, who knows? We don't know anything else about that. A Black feminist would say, wait a minute, you got to frame that. You got to contextualize that. You got to read that. It doesn't work in the US context. What is a global context? Have we seen this anyplace else in history? How can that offer us some clues to elucidate what's happening here?
Yes, this is we're running a little low on time here. We have about 5 minutes left, so I want to take kind of a moment, step back, and I enjoyed reading Jim your piece in the Atlantic magazine, and this made me think of this question for you, which is, as a medical historian, we do this as kind of public historians working with Civil War medical history, but I'm wondering what has been your experience during this pandemic?
Do you really want to know?
Oh,
This is,
yes.
okay. So all of these things that we're talking about, contact tracing, epidemiology, infection rate, mortality rate, none of this is new to me. None of this is surprising to me. This is stuff that I've done for 20 years. What I think about is that every time I say something, people are like, oh, you're a Trump supporter. It's like, no, I'm not a Trump supporter. I'm trying to frame this. I'm trying to think about this. And so the first piece is that we have to realize, we have to sort of we have to think about what quarantine is. So first of all, quarantine never worked. And quarantine, there will always be deadlines. You couldn't, Malta, 1835, you couldn't just quarantine people until things start looking better. They would be for 30 days. You would have, there would always be a time limit. There would be a timestamp on it. What it means, there was always questions about the economy that were connected to quarantine. Trump didn't invent that, the right, left didn't invent that. So these ideas about the economy and politics, also about how different ideological sides see the epidemic, plays out exactly to the 19th century. I would say that from the Atlantic article, the epidemic doesn't scare me that much from the vantage point of medical history, because there's been a response to it. So this is where people are like, oh, well, you're congratulating Trump. I'm not congratulating Trump. I'm trying to say that when we looked at smallpox, I want you to find me all of the times Lincoln said smallpox. I want you to find me all the things Lincoln did in response to smallpox. He did not. So the fact that we have press conferences every day, that's a good thing. Now you could say, oh, that means you support Trump. No, it doesn't. I'm saying that the failure of epidemics is when you brush it under the rug. So when people ignore it, when people refuse to talk about it, when HIV broke out, people talk about, oh, the hospitals, what's happening. Let me tell you something about HIV. Let me tell you about what happened to gay people. First of all, they would go into the hospitals. Once they were in the hospitals, doctors or nurses would not touch them. Those people would be left in their bed, sores on their body, sores on their tongue, not being able to eat. And the nurse's aide would leave the food outside the door, would not even walk in. That is a problem. Now, so again, I think about this. And then once that happened, queer people refused to go to hospitals for how they were being treated, right? And they wouldn't be touched. They'd be afraid to touch their body. And so there's the idea that we're supporting patients. We're trying to avoid stigma. These are all good things, right? I don't think there's a stigma. All those celebrities, Andy Cohen, Tom Hanks, Idris Elba, all saying they have COVID. Very good. It's good, because then it avoids stigma. There was stigma with HIV. So what I'm saying is that all of the stuff that's happening means that it will end, and it will not be this thing that destroys us. Epidemics that destroyed people were epidemics where people didn't talk about them, and where doctors in the medical profession wouldn't touch people. That's when you had serious problems. And in the article, I mentioned Jacobs. I mentioned people, my own family, who went out there and did work for them, because all you had was community health. So Cuomo's doing an important thing. He's in New York State. He's using state money to go into the Black churches to provide testing. For centuries, that was always left to marginalized populations to fend for themselves. Lesbians that had to help gay men, Black women had to help people in their own families. You didn't have the intervention of the state. So anytime I say this, people are like, oh no. And it's like, no, it's not to say that the mortality isn't terrible. It's not to say that the infection rate isn't terrible. It's to say that, wow, that is a shift. That's a shift. And those are important things. And that's why I'm not worried about it. And then we have to frame it. We do have to say again and again and again, 80% of people can resolve on their own. You cannot say that to someone who had HIV. You cannot say, oh, you're infected with HIV, lay on your couch and watch Netflix. Chances are you can resolve it on your own. That's remarkable, right? We didn't have an antiviral for HIV until much later. With smallpox, with polio, you just couldn't say, sleep it off. So there's this effort when we talk about testing, we have to put that into context. That's what historians can do. We can put it into context. We talk a lot of times about the number of infected people. What's the denominator? 30,000 people were infected. How many people that were tested? These are just basic analytical ways of thinking about it that I think it's really useful. But again, it's hard to talk about because everybody's sort of like stuck in how they want to see it play out. And I don't know. I mean, I do know. I just worry.
Yeah. It's helpful that you point out that this is going to come to an end, that there is we may not see the light at the end of the tunnel, but it is there and we can know that it's there. And that is another nice thing about history, as you said. Again, part of our mission is making these lessons relevant to today.
Right.
We know from the past that we're going to get through this. Right. It may not feel like it when you're in the middle of some of these really dark times, but there is hope. And that's a big part of the message.
It's the epidemics that don't end are that, I mean, listen, there's always, so marginalized people and people that don't have healthcare and people who have problems are going to suffer more. That's always the case. That's going to be, and that's something we should do. So immediately, as soon as the epidemic happened, instead of quarantining everything and shutting everything down, they should have deployed right there to the vulnerable communities. That would have been the first thing. I mean, that would have been the first way of learning from history. But the other thing about learning from history is that the epidemics continue and linger on when people don't do anything and they get worse. If we're all doing something, then that's going to mitigate it. That really will mitigate it. And that's what we're seeing. And we have to be careful that vulnerable populations at this moment, especially like incarcerated populations. I mean, think about this all the time. The prison is a quarantine facility that leads to infection rates. And we see this in nursing homes. So it's really what we can learn from the past is who are our vulnerable populations and who are those people who can't do basic things like quarantine, and how is their social position going to exacerbate their spread of disease. I think if we think about those things first, we'll be much more prepared about the second wave. Second wave comes, then deploy those resources immediately to those vulnerable populations, and then start thinking about everything else.
Well, thank you so much for joining us today, and thank all of you out there for joining us as well. We're a little bit past our hour mark now, so we're going to have to pull the plug on this pretty quick. We'll try to go back and answer as many of your questions in the comments as we can. Again, if you enjoy this program or other programs, consider becoming a member in the future. I'm sure Jake joins me in once again saying, Jim, thank you so much for your time. We know that as a medical historian, you've got to be very busy right now, but we really appreciated having the time to talk to you about your book, Sick from Freedom.
Thank you. Thank you so much for having me.